name is Shelley Pitts, and today we'll be talking about the healthcare industry, hospital management, and how AI has impacted that sector. Specifically, just to give a quick industry overview, Davenport Mental explained that the hospital management and healthcare industry has been slower to use and utilize uh, artificial intelligence, and that is likely because of the lack of vast data available to them, and considering ethical implications when we're talking about human beings, their well-being, their health, and using different technologies that could impact the well-being of the greater good. If we're talking about the business problem, that is very much linked to that, and how the healthcare industry can use AI going forward to have a positive impact on the industry. We'll talk about the solution analysis. I'll provide two solutions, and we'll consider ethical and law impacts. And we will discuss future thinking and just a little bit about my personal reflection. The first solution, I did some research and found that predictive analytics is very prevalent within the healthcare industry. Specifically, Johns Hopkins and GE have partnered, and they are looking at trends in ER admission, ambulance dispatch, and they're using artificial intelligence to assure that their facility is more productive. And they're also using technologies for scheduling algorithms and agent paradigms, which I found fascinating. These agent paradigms are a technology that can take the place of the human aspect and make things more efficient. And this can include reducing wait times, resource allocation, helping with scheduling, staffing, and really the care continuum of the whole patient. So if a patient is in the hospital, they can help facilitate admission, lab testing, radiology, and communicate all of that information back to the electronic medical record system and relay that information to the physicians and to the care team. The second solution that I researched was robots to aid in hospital management. And these robots have a very large capability to do different things, specifically patient monitoring, pattern recognition, sterilization. There's been many studies. Me et al. Did a study during COVID on the impact of using robots to aid in efficiency for sterilization, and then also for logistics and operations. These robots also have the capability to not only complete these tasks of sterilization and gathering information and doing different patient monitoring, but they also absorb all this information and therefore have a very large amount of patient data that can be used on the back end for different operational uses and efficiencies. Ethics and law. So of course, when we're talking about patients, we're going to have the issue of patient privacy. This is very important, protecting patient rights and data. I found a study where the UK had developed a project that reduces the risk of jeopardizing patient information. This was very interesting because they're using studies to prove that their AI initiatives, the different technologies, have a positive impact on the patient, and the use of clinical data in these kinds of trials to prove efficacy. Meaning, we're not just using this data, we're not using this technology just on the whim, that there's some evidence, there's evidence-based research to show that AI will benefit the patient in the long run. And then also a second consideration is accountability and transparency. This is very important. The decisions are evidence-based, they're non-biased, and then this going forward, experts are concerned that providers could be reliant on AI-based decisions, and that could impact the quality of care the patient is receiving. So that's also an important ethical consideration. Future thinking. So we know, going back, that considering Davenport and Mittal's explanation that in arguments that the healthcare industry hasn't necessarily been the quickest to use artificial intelligence. There's a vast amount of opportunity within this field. There's also, this is important to consider the impact on jobs. There's a lot of research, there's a lot of different technologies that could possibly take the place of radiologists who are reading x-rays, who are reading reports, where now AI is doing that. And then also considering the impact on operations. In one of my solutions, I spoke about the impact of robots and having all of that data, absorbing all of that data and having that on the back end. And then just considering all of this with the history of stagnation of AI within the field. My personal reflection. So I am in the field of healthcare, so I found this very interesting. I can see front and center the slower implementation of AI, and when I look at that, I can see that it's mostly because of the lack of research and the lack of lack of ethics to back the different AI initiatives. And personally, in my operational role, the solution of agent paradigm was fascinating to me, to see how having an agent paradigm in place can really facilitate the care of a patient from admission to discharge and every step in between. Was very interesting. And also how robots can not only complete the tasks efficiently and increase productivity, reduce wait times, but they can also gather information that for someone like me in an operational role can use to increase efficiency, resource allocation, things like that. And that is all. Thank you so much, everybody.